Good morning. This is Dr. McDaniel at GYN Corner. I'm a board-certified obstetrician gynecologist in New York City, and I'm bringing to you all things health-related for women. Thank you for joining me here at GYN Corner. This is the Facebook Live page. Please hit the like button if you enjoyed today's presentation or the most recent ones, and please follow so you get a heads up on when the presentations are coming and what the topics are going to be. Today, as I stated on the title, the continuation of the ovarian cyst presentation is following up today with a goopy, gunky, mucousy one called a mucinous cystadenoma, and that's because it's full of mucin. So as I mentioned at a previous presentation, there are multiple types of ovarian cyst, and the cystic changes are due to fluid-filled bags of ovarian tissue. So the different types of tissue in the ovary is what dictates the type of cyst that's going to be produced. And the types of cysts that are produced by the ovaries can come from the skin layer, which is the epithelial layer, and we have multiple cysts. The most common are the serous cystadenoma and the mucinous cystadenoma. Less common ones are the endometrioid and the Brenner tumor, or the Brenner. It's called a Brenner tumor, but it has liquid pockets, so we still consider it a cyst. And then the once you leave the skin or the epithelial layer, you dig deeper into the makeup of the ovary, the tissue, and we call those sex cord stromal cystic changes, or neoplasms, which are growths, be they solid tissue or liquid. And from the sex cord stromal, you have fibromas, thecomas, fibrothecomas, granulosa cell tumors, which are also called angioblastomas, and then sertoli-Leydig cells, which sertoli-Leydig cysts, which are also called angioblastomas. So, and then last are the germ cell tumors, which are mature cystic teratoma and the dermoid. So those are all the cystic changes of the ovaries, and those are all benign changes, so they're not cancerous, they're not malignant. Today, the mucinous cystadenoma is different from the serous cystadenoma because the serous cystadenoma is full of clear liquid or straw-colored, slightly yellow-tinged water. And the mucinous cystadenoma is a goopy, thick, tenacious type of liquid. It's almost like congealed hair gel, or even like snot from someone's nose. It's the same kind of color, the same almost texture, except it's thicker and goopier. It's mucin. And the presentations for the ovarian cyst are all the same. So most people won't have any type of pain or any clue that they have the cyst. If the cyst gets pretty large, they may start to have pressure and discomfort. But predominantly they're picked up incidentally. So pressure and discomfort, maybe they think they have a bladder infection because they're urinating frequently. The cyst is sitting on the bladder or sitting on the uterus, which is putting pressure on the bladder. Or maybe they're having bowel issues, so they're having difficulty having bowel movements, which is called obstipation, or just a heavy pressure discomfort with sexual activity or with exercise. So they come in for an evaluation, and then the cyst is picked up because of the physical exam. We do a bimanual or physical exam, and a mass or a fullness is noted, and then an ultrasound or a sonogram is the test of choice. That's going to show us that they have a liquid-filled structure in the pelvic region. For GYN, we don't usually do CTs or MRIs unless there's a question about blood flow lymphatic or tissue changes if there's a solid mass. So once we discover the person has a cyst, it's a pocket-filled lump of fluid. Mucinous cystadenomas are also usually unilocular, so it's usually just one big water ball filled with the thick, goopy mucin. Sometimes they will have 2 or 3 walls. We call those septa. So sometimes they will be septated, so they'll be, or what we call also loculated. They'll look almost like a honeycomb, but not as complex. So they might have 1 or 2 small, thin, filmy walls. And the surface of the mucinous cystadenoma is also smooth, just like a serous cystadenoma, except it's very smooth, glossy, except it's usually lumpy. So lots of lumpy, almost like you take a blanket and put it over a whole bunch of grapefruit and pebbles and rocks. So the blanket is satin, it's smooth, but you can feel all of the lumps and bumps underneath. So that's how mucinous cystadenomas usually appear. Now they also can range in size. On average, they're usually discovered around 8 to 10 centimeters, so around a grapefruit to a cantaloupe size. But the range can be as small as 2 to 3 centimeters, so size of a golf ball or a large olive, fat Greek olive, but they can be as large. They've been in the literature noted to be as large as 40 centimeters, which is full-term pregnancy size. So someone who's 9 full months of pregnancy is how they can also present huge. I had a patient several years ago who had a mucinous cystadenoma. She had no clue that there was a cyst. She hadn't seen a gynecologist in about 15 years or so, and she was a heavy-set lady. She was around 5'6", and she weighed almost 300 pounds, and a lot of that was just belly. I did her exam, and I'm usually pretty good at being able to feel on the bimanual, the pelvic exam, the uterus. Even in a very heavy-set woman, I can usually feel her uterus. I couldn't feel anything. And since she hadn't been to the gynecologist in years and years and years, and I absolutely couldn't feel anything, I sent her to have an ultrasound or a sonogram. We do those in my office now, but back then, everyone went to radiology. So I sent her to radiology, and we were both surprised. She was surprised, and I was surprised. She had, hers was the size of a watermelon, so about a 22 to 24 centimeter mucinous cystadenoma. She had no clue. She felt totally fine. Even when I went to take her for surgery in the operating room under anesthesia, I did another biomanual. I did another pelvic exam because I'm like, geez, can't believe I couldn't feel a watermelon-sized cyst in this lady. I know she's heavy, but come on. Even under anesthesia, I could not feel it. She had so much belly fat that that watermelon-sized cyst was just deep in the pelvis. Even with the pelvic hand, I couldn't feel anything. So that's the validity of when in doubt, check it out. So under surgery, when I removed the cyst, it was the size of a watermelon, big, lumpy, smooth, glossy mucinous cystadenoma. Totally benign. And for mucinous cystadenomas, 80% of mucinous cysts are benign. They're adenomas. Benign, non-cancerous, not malignant, not a problem. We take the cyst out, lady's happy. 5% of women with a mucinous cystadenoma will have either at the same time a mucinous cystadenoma on the other ovary, or at some point in time will have the other ovary afflicted with the same cyst. So 5% of them are bilateral. 80% of mucinous cysts are benign, so they're not huge deals. The age range is pretty broad, anywhere from early 20s to late 40s is the usual range. The patient I had with this huge one, she was in her late 40s to early 50s, and she did spectacularly well. I just took the cyst out. We didn't do a whole hysterectomy. It wasn't necessary. It wasn't indicated. So it was a quick procedure, and she went home the following day. The treatment is always going to be surgery. These cysts are never, never, never going to go away on their own. They're very, very slow growing, so they're not emergencies, but they can get pretty huge. So treatment's always going to be surgery. It's usually going to be day surgery, just through a laparoscope, the camera type of surgery, if we catch it when it's fairly small. If it's huge like this lady's, it's always going to be open. We call that exploratory laparotomy. That's why the patient I had, she had to stay overnight. We let her go home the very next day because I was able to do it through a bikini cut, fan and still incision. But the treatment's always going to be surgery. It's going to be removal of the cyst. If there's complications, then the whole ovary. But usually we can peel off the capsule of the normal ovarian tissue, remove the cyst that's burgeoning, growing inside that normal ovary, sew up the ovary, and she's good to go. So I hope that's been helpful information on Mucinous cystadenoma, the goopy, gunky sister of the serous cystadenoma. Thank you for joining me here at GYN Corner. This is Dr. McDaniel. This is a Facebook Live presentation. Please, please, please hit the follow button and the like buttons, and please check out the YouTube channel. It's also called GYN Corner. Hit the follow button to get a heads up on presentations, and please add comments and questions. I'll be more than happy to answer them and to do presentations on any suggestions you may have. And I enjoy podcasts. I have a lot of friends who enjoy podcasts. If you enjoy podcasts, please check out the GYN Corner podcast. It's on 8 different platforms, and of course I never remember all of the platforms. It's Anchor, Apple iTunes or Apple Podcasts, Google Podcasts, Spotify, Breaker, Overcast, Podcast Addict, Radio Public, and Pocket Cast. Thank you very much again. Have a great rest of your Wednesday. See you at the next presentation, and we'll still be going on and on and on about ovarian cyst. Bye.